Hello and welcome to Pregnancy Info. Today we are discussing the topic TORC test or TORC screen. A TORC screen is a panel of tests for detecting infection in pregnant women. Infections may be passed on to a fetus during pregnancy. Early detection and treatment of an infection can prevent complications in newborn. A doctor usually performs some component of the TORC screen routinely when a woman has her first prenatal visit. They may perform other components if a woman shows symptoms of certain diseases during the pregnancy. These diseases can cross the placenta and cause birth defects in the newborn. These conditions include cataracts, deafness, intellectual disability, heart problems, seizures, jaundice, low platelet levels. The test screens antibodies to infections, diseases. Antibodies are proteins that recognize and destroy harmful substances such as viruses and bacteria. How is a TORC test performed? A TORC screen involves taking a small sample of blood. The blood is usually taken from a vein located in your arm. You will go to lab and a phlebotomist will perform the blood draw. They will clean the area and use a needle to draw blood. They'll connect the blood in a tube or in a small container. You may feel a sharp prick or stinging sensation when the blood is drawn. There is typically very little bleeding afterwards. They will apply a light pressure bandage over the puncture site once the draw is complete. Specifically, the test screens for two different antibodies, immunoglobulin G and immunoglobulin M. IgG antibodies are present when someone has had an infection in the past and is no longer acutely ill. IgM antibodies are present when someone has an acute infection. A doctor can use these antibodies along with a woman's history of symptoms to assess if the fetus has been exposed to an infection. Diseases detected by a TORC screen. Toxoplasmosis. Toxoplasmosis is a disease caused when a parasite T. gondii enters the body through the mouth. The parasite can be found in a cat litter and cat feces as well as in undercooked meat and raw eggs. In fact, infected with toxoplasmosis in the womb usually don't show any symptoms for several years. Symptoms which occur later in life can include vision loss, mental retardation, deafness, and seizures. Rubella. Rubella, also known as German measles, is a virus that causes a rash. The side effects of this virus are minor in children. However, if rubella infects the fetus, it can cause serious birth defects such as heart defects, vision problems, delayed development. Cytomegalovirus. Cytomegalovirus or CMV is the herpes virus family. It usually doesn't cause noticeable symptoms in adults. However, CMV can result in hearing loss, epilepsy, and intellectual disability in a developing fetus. Herpes simplex. The herpes simplex virus is usually transmitted from the mother to the fetus in the birth canal. During delivery, it's also possible for the baby to become infected while it's still in the womb. The infection can cause a variety of serious issues in infants, including brain damage, breathing problems, seizures. Symptoms typically appearing during the baby's second week of life. Other diseases. The other category can include several different infectious diseases such as chickenpox, Epstein-Barr virus, hepatitis B and C, HIV, human parvovirus, measles, mumps, syphilis. All of these diseases can be spread from the mother to the fetus during pregnancy or delivery. What are the risks of a TORC screen? The TORC screens are simple, low-risk blood tests. You may experience bruising, redness, and pain at the puncture site. In very rare cases, the puncture wound can become infected. There is no risk to the fetus to have these tests. What do TORC screen test result means? The TORC screen results show whether you currently have an infectious disease or recently had one. It can also show if you have immunity to certain diseases like rubella from being previously vaccinated yourself. The results are termed either positive or negative. A positive result means IgG or IgM antibodies are found for one or more of the infections covering in the screening. This can mean that you currently have had in the past or have been previously vaccinated against the disease. Your doctor will explain the test results and review with you what they each mean. A negative test result is generally considered normal unless it is for a disease that you should be vaccinated against. That means no antibodies were detected and there is no current or past infection. So this is all about the TARC screen test or the TARC test during pregnancy. If you find this video useful, then like it, share it, and also subscribe our channel. Thank you.